Title: The Federal Prison Where Sickness Turns to Death, FMC Carswell Exposed. Help this channel grow. Like the video, leave a comment, and subscribe for more stories. This helps us a lot. Thank you. The story begins. The walls that breathe silence. In the heart of Fort Worth, Texas, behind tall fences lined with razor wire, sits a facility few Americans know exists. FMC Carswell, the federal medical center built for women in the custody of the United States Bureau of Prisons. It was designed to be a place of healing, a federal hospital for inmates suffering from cancer, heart disease, mental illness, and chronic conditions. But over the years, its name has become synonymous with neglect, silence, and death. What was meant to be a sanctuary for care has instead been described by former inmates as a warehouse for the sick. Officially, Carswell is an administrative facility, meaning it holds prisoners from every security level, from non-violent offenders to women serving life sentences. Inside, there are no comforting medical wards. Instead, there are locked corridors, barred doors, and the constant echo of intercom announcements cutting through the sterile air. When it opened in 1994, the Bureau of Prisons promised it would revolutionize medical care for female inmates. The complex was built on the grounds of a former U.S. Air Force hospital inside a secure military base. The idea sounded noble. Women who were too sick for standard prisons would receive specialized treatment in a hospital-like environment. But within a few years, the reality turned grim. Reports began to surface of delayed surgeries, untreated infections, and ignored emergencies. Inmates wrote desperate letters to family members describing how they waited days for medication, only to be handed painkillers instead of actual treatment. Some said nurses were compassionate but overwhelmed. One nurse for dozens of patients, with limited equipment and no outside oversight. By the early 2000s, the name Carswell began appearing in lawsuits and investigative articles. One of the earliest high-profile cases involved inmates who died from treatable illnesses, pneumonia, asthma attacks, even diabetes complications, conditions that should never have been fatal inside a federally funded medical center. Families accused the prison of covering up what really happened inside those locked units. Former prisoners began calling it the Hospital of Death. Among them was Marsha Williams, an inmate who developed breast cancer while serving time for a nonviolent offense. Her family claimed she repeatedly begged for diagnostic tests and was denied. By the time she was finally sent to an outside hospital, it was too late. The cancer had spread. She died inside Carswell in 2000. Her story made headlines and led to questions in Congress about medical oversight in federal prisons. But Marsha's case wasn't isolated. In 2003, another inmate, Marilyn Buck, a political activist, spoke publicly after her release, describing medical neglect and the emotional toll on women confined there. She said, "You don't get well at Carswell. You get forgotten." Inside the walls, mental health patients shared cells with those undergoing chemotherapy. Prisoners in wheelchairs were forced to climb stairs because elevators were broken. The sound of coughs, cries, and intercom buzzers became the rhythm of everyday life. One of the most haunting aspects was the secrecy. Unlike state prisons, federal medical centers rarely allow media visits or camera access. That meant whatever happened inside FMC Carswell stayed inside. Families who demanded answers were often told that medical privacy laws prevented disclosure. Inmates who spoke up risked punishment. Some reported being placed in segregation or losing privileges for complaining about treatment. Others said the fear of retaliation kept them silent, even when their health was deteriorating. Outside the fences, advocates and journalists started piecing together the truth. Between 1998 and 2010, multiple watchdog organizations recorded a disturbing pattern: a disproportionately high number of deaths compared to other federal women's prisons. The cause wasn't riots or violence, it was illness, untreated or mismanaged. Even some correctional officers quietly admitted that things were not right. One retired staff member later told reporters that the facility was underfunded and understaffed for the level of medical care it was supposed to provide. "It's a hospital in name only," he said. FMC Carswell was never meant to be a horror story, but for many women, it became one. The stories of lost mothers, daughters, and sisters echo through its corridors, sealed away behind steel and bureaucracy. As night falls over Fort Worth, the prison's lights glow against the Texas sky, a reminder that inside hundreds of women sleep under government care, some battling terminal illnesses, others simply waiting for the day they're noticed again. For their families, one question remains: how did a federal medical prison become one of the most feared places for women in America? That question would soon be answered, not through official statements, but through the testimonies of survivors and staff who could no longer stay silent. The inmates who spoke up and paid the price. In the years after the first deaths at FMC Carswell drew headlines, the Bureau of Prisons insisted that everything inside the walls was under control. Official statements described the facility as a compassionate, well-equipped medical center providing quality care to female inmates. But behind those carefully written press releases, stories of mistreatment kept surfacing, whispered through phone calls, letters, and smuggled notes from inside. Women who dared to speak up about the conditions said they faced a new kind of punishment, one not written in any rulebook. Some were written up for disruptive conduct. Others were quietly transferred or confined to solitary cells under the pretext of mental health evaluation. For a prison built to heal, silence had become its strongest medicine. One of the first whistleblowers was Barbara Bunny Burroughs, a diabetic inmate who lost her eyesight after months of inconsistent insulin doses. In letters later released by advocacy groups, she described being threatened after filing grievances about the medical unit. "They told me I was making trouble," she wrote. "When I asked for my insulin on time, I was told to stop acting entitled. After that, the guards stopped talking to me altogether." Her story was echoed by many others. Women who complained about chest pain were accused of faking it. Those who requested to see outside specialists waited months, sometimes years, for approval. The sickest prisoners said they were handcuffed to hospital beds during outside appointments, even when barely conscious. In 2006, the Dallas Morning News published a rare investigation based on interviews with former inmates and internal reports. It revealed that at least 105 women had died at Carswell in just over a decade, a mortality rate far higher than comparable facilities. Many of those deaths, the article claimed, involved treatable illnesses. That report caused outrage, but also fear inside the prison. According to later testimonies, some staff members were ordered not to speak to reporters or to maintain institutional integrity. One nurse anonymously told journalists that everybody knows what's going on, but nobody wants to lose their job. Among those who refused to stay quiet was Veronza White, a former medical assistant turned inmate. After witnessing a fellow prisoner die from untreated sepsis, she began documenting incidents in secret notebooks. Names, dates, symptoms, staff responses. In one entry she wrote, "This place kills women slowly. Not with violence but with waiting." When White's notes were discovered during a random cell search, she was moved to a restricted housing unit, a form of isolation. Officially it was for security review. Unofficially it was a warning. She was released years later and went public, testifying before prison reform advocates about what she saw. Her story helped spark renewed congressional attention on women's prison healthcare. But FMC Carswell's problems went deeper than neglect. Investigators uncovered allegations of sexual abuse by staff, spanning nearly 2 decades. In 2008, a correctional officer was convicted for assaulting multiple inmates. Several women claimed that they were coerced into silence, their medical treatment or privileges threatened if they refused. One victim told federal investigators, "If you complain, they send you to the psych ward, and once you're labeled unstable, nobody believes you again." That psych ward became infamous among inmates. They described it as a place of total control. Bright lights always on, cold temperatures, constant surveillance. Some women said they were medicated without clear consent. The line between mental health care and punishment blurred beyond recognition. Outside the fences, activist groups began forming around Carswell's reputation. The Carswell Coalition to End Prison Abuse published testimonials from former inmates and families. They called the facility a federal black hole, where women vanished into medical bureaucracy. Civil rights lawyers began filing wrongful death suits on behalf of families, but few succeeded. The Bureau of Prisons, shielded by sovereign immunity and privacy laws, rarely acknowledged wrongdoing. One case that did reach national attention was the death of inmate Andrea Armstrong in 2011. Her family said she was repeatedly denied emergency care despite showing clear signs of distress. Internal records later confirmed she was found unresponsive hours after her first complaint. The official cause, cardiac arrest due to natural causes. But her cellmate told reporters a different story, that Andrea begged for help while guards walked past her door. For the families, each death was a wound with no closure. For the survivors, each interview was an act of defiance. By the mid-2010s, the hashtag Justice for Carswell Women began circulating online, shared by activists demanding reform in the federal prison medical system. Yet despite media attention and official hearings, little changed. Funding cuts, understaffing, and an aging inmate population kept the system strained. Today, many of those who once worked at Carswell describe a culture of quiet despair. Doctors who tried their best but were buried under bureaucracy, guards torn between orders and conscience, and inmates who realized that survival depended on silence. In a 2019 advocacy documentary, a former Carswell nurse summed it up in one chilling line: "They come here sick and they leave in a box." The stories from inside kept spreading, until the public could no longer ignore them. But exposing what really happened at Carswell would require more than testimony. It would take evidence, internal reports, and one shocking discovery that changed everything. That moment, when the truth finally surfaced, became the breaking point for America's most controversial women's prison. By 2019, the name FMC Carswell had become a byword for failure inside the federal prison system. For years, survivors' accounts were dismissed as exaggerations, but then something happened that no press release could contain: a wave of leaked internal reports and staff testimonies that finally forced the public to see what really went on behind the barbed wire. The breaking point came when an anonymous employee, later identified as a former medical records clerk, leaked documents showing a shocking pattern: delayed diagnoses, falsified health logs, and ignored emergency requests. In one file, a doctor noted that a patient's symptoms were critical, yet her treatment was postponed for over 3 weeks. The woman died before the follow-up appointment ever happened. The documents matched the testimonies that former inmates had been giving for years. Advocates now had proof. Carswell's failures weren't isolated mistakes. They were systemic. News outlets began investigating. PBS and the Texas Tribune ran a joint report featuring interviews with ex-staff members who described a culture of deliberate indifference. One nurse recalled, "We were told to document everything neatly, but never escalate anything unless it was life or death. And even then, sometimes it didn't matter." By that time, Carswell's inmate population had swelled to over 1,000 women, many elderly or chronically ill. The facility wasn't equipped for that number, and the medical infrastructure, designed for an Air Force hospital in the 1960s, was collapsing. Leaking pipes, malfunctioning elevators, and broken air conditioning units made conditions unbearable during Texas summers. Then came the COVID-19 pandemic in 2020. For a prison already battling medical neglect, the virus became catastrophic. Reports later revealed that dozens of inmates contracted COVID within weeks. Some died alone in isolation units, with families informed days later by form letters. The Bureau of Prisons issued statements claiming all appropriate measures were taken, but survivors told a different story, a story of fear, confusion, and death without dignity. One inmate, Andrea Highbear, was 8 months pregnant when she contracted COVID-19 at Carswell. She gave birth while on a ventilator and died shortly after. Her baby survived. Andrea's death made national headlines and reignited outrage over how sick inmates were being treated. Advocates argued that she should have been released on compassionate grounds long before infection. Instead, she became another statistic in a system that had long ignored its most vulnerable. As public pressure mounted, federal lawmakers demanded an investigation. In 2021, the Office of the Inspector General (OIG) reviewed Carswell's operations. Their findings, though partially redacted, confirmed years of complaints: inadequate staffing, poor infection control, outdated facilities, and failures in medical documentation. The report stated bluntly, inmates with chronic conditions are at significant risk due to inconsistent medical care. For the first time, the Bureau of Prisons publicly acknowledged deficiencies at FMC Carswell. But for the women who had lived through it, acknowledgement wasn't enough. They wanted accountability. Former inmate Kimberly Rivera, who served 5 years there, began collecting survivor stories for a documentary project titled Carswell Voices. She interviewed more than 50 women who described the same pattern: pain dismissed, symptoms ignored, hope lost. "We used to joke that the only way to get out of medical was in a body bag," one woman said on camera, her voice trembling. By 2023, the mounting evidence forced the government to make limited reforms. Some staff were reassigned, medical staffing levels increased, and a review board was created to oversee care. But for many, the changes came too late. Over 200 women had died since the facility's founding, a number that critics called unacceptable for any institution claiming to provide health care. Today, the fences of FMC Carswell still glint under the Texas sun. From the outside, it looks calm, rows of beige buildings surrounded by orderly lawns. But to those who know its history, the stillness feels haunted. Every hallway, every room, every medical ward holds stories of neglect and resistance. For former inmates, the memories are carved deep. The sound of the intercom announcing codes, the smell of disinfectant, the faces of women who didn't make it out. One survivor, now free and working as a prison reform advocate, said it best. Carswell isn't just a prison. It's a mirror, showing what happens when a system forgets that inmates are still human beings. In 2025, as new investigations continue and more survivors speak out online, the legacy of FMC Carswell remains unresolved. It stands as both a warning and a plea, a warning about what happens when accountability vanishes, and a plea for compassion in a place built to punish. Because behind every statistic there's a name. Behind every headline, a life that could have been saved. And behind those walls in Fort Worth, Texas, the federal prison where sickness turned to death, the echoes of those lost voices still linger, waiting to be heard.